Welcome to America's Heroes Group.
And welcome back to America's Heroes Group, our roundtable with our partner, National Nurses United. Today is Saturday, August 20th, 2022. August is National Wellness Month. Our host is Kelley. I'm Sean Claiborne, the co-host. Executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have our partner on the line, Miss Adelena Marshall. She's a VA mental health nurse. And we want to talk about legislation to pass regarding burn pits, care for burn people that were exposed to burn pits, and also the signs and symptoms of Monkey Pox. How you doing, Miss Marshall?
I'm great, and how are you? And thank you for having me on your show today.
It's our pleasure.
Thank you to America's Group.
Our pleasure's all ours. So tell us, what do we need to know about the burn pits, the legislation that passed? What should vets be doing right now about this?
Well, the first thing is, if veterans are not affiliated with VA for treatment and care, they need to sign up so that they can get into the system. They should get whatever required paperwork together. And then if they have any concerns that they have any sort of cancer that could be related to being in Iraq or Afghanistan near those burn pits, at the burn pits, any place the smoke may have affected them, that they should immediately come to the VA so that they can get treatment, which we are so excited that the president has pushed this forward for the care of our veterans. Our concern also is that as they open up the programs to the veterans, that they also review the staffing and the training of the staff so that we can be better prepared to take care of the veterans that we're expecting to get through this legislation.
So I wasn't deployed, but I did know about the burn pits, and I'd seen them burn pits many times on videos and social media and things like that. And I knew the process of how they were, because you're kind of trained in that, and I was in maintenance. How was the burn pits different from what was done in previous wars? Because it seemed like it was relied upon a lot in Afghanistan and Iraq. But what was different about the burn pits than what you saw in Vietnam? And then the veterans who were exposed to those types of chemicals during those times, what's the exposure risk from previous generations?
What has come from studies more so out of Vietnam is the impact of Agent Orange on those veterans, which was used to destroy the shrubbery and things like that that allowed the Vietnamese to hide in. I'm sure that the Vietnam vets, they're all in their early 70s, going into their 80s, and that maybe if they have been affected by those things that they have got treatment, but it may not have been identified as being related to issues with the burn pit. And they may not have had to destroy things the way they had to do in these other two war or conflicts that we were in.
And it seems like, too, like the stuff that we're burning, like we pretty much burn everything. Like we burn, and then using jet fuel, which is not the best thing in the world to take in as a fume into your lungs. I think
the jet fuel, using the jet fuel is also a major causatory factor towards towards cancer, as well as the wiring, electronic wiring that has coatings on it. There may be copper in it that as melts down is inhaled as people are standing around the burn pit. And then tires and things, it has cotton and oil and rubber. And all of that contributes to your lungs being attacked with all these chemicals. And then through the years, some people, because of that, has developed a cancer, and even maybe a brain cancer too.
So what do you do? So if you've been exposed to these things, and you're seem healthy now, but you're worried about that maybe in 10 years or 15 or 20 years or when you get older that something might happen to you. But I mean, because cancer is scary. That's a scary thing to think about, that you might develop cancer down
Yeah,
the road.
first thing I would encourage anyone to do is to register at the VA and go in and get everything documented, get your orders to show that you were there, because even during Vietnam, I think a center in Kentucky burned, and a lot of Vietnam vets had a problem being able to verify certain aspects of where they were deployed to. So we even recently learned about, Navy who carried Agent Orange to these areas that were also exposed to. It wasn't just the veterans on the ground who were fighting the soldiers and the Marines and everything. It was also, they're also finding out that there was many of the soldiers who participated in handling these items one way or another, that perhaps they weren't properly covered and had the proper equipment to handle these items.
So you think soldiers are going to be more aware, having gone through this really 20 years of conflict through Afghanistan and Iraq, knowing when you're smelling these burn pits, it could be a good thing. You see the smell, this nasty toxic chemical. It smells like, somebody lit some like a dead rat on turpentine or whatever and set it on fire. I mean, the thing is, are veterans and service members in the future going to be more cautious, or maybe not the word cautious, not the right word, but maybe even more hesitant to think about joining the military, or maybe being more scared about what they're touching and what they're around, what they're exposed to?
I think just like the workplace environment, that when OSHA identifies something as being a hazard, these situations have been identified, and that they will probably, the Pentagon, hopefully, or whoever's in control of all this, will look at what they're purchasing, what these items are made out of. Do our soldiers, including all branches of the military, have proper gear to work with these things? So I think every situation provides a learning curve, and make the military, American public, soldiers all over the world to be more aware of what is going on.
So now, looking back at my time in the military, I mean, now I start thinking about, wow, maybe it's a good idea to pack your own PPE, your protective equipment. Make sure you have, masks. You have a gas mask that you're issued, but maybe having, respirators, that you can get from Home Depot, whatever. Order respirators and have that part of your equipment, your own personal equipment. Because a lot of the equipment you have when you're in the military, you purchase on your own. You get it for yourself because it makes you more comfortable, and then it makes it easier for you to do your work. Buying your own PPE might be something we got to think about now.
Well, I'm glad that you brought that up, because I think a PPE is something maybe every household should have, because you never know what may come up. Even if you're traveling or something, you don't know if you're in a hotel, it might catch fire or maybe attack, and you put that equipment on. It gives you a fighting chance. So it's something, to think about. I've traveled a lot in my prior job, and we're always concerned about things happening and stuff. So and that's a good thing, I think, to maybe everybody buy one and keep it. Or if you're traveling a lot, your exposure goes up just to carry it. And I'm sure the family of the military, our military men and women, they'll be looking at and making sure they have everything that they need so that they can come home safe.
And then there's a registry as well for burn pits. So people are supposed to call the registry to let the military know that they have concerns about exposure?
Yeah, but I would, even if I don't have immediate concern, even though I'm not having any signs and symptoms, brain cancer kind of sneaks up on people. It may start with a headache. They may get, the eyes burning, something to let them know is something is happening. And sometimes people don't follow up. They'll just go take a Tylenol and, it'll be okay. And it might clear up for a minute and then it comes back. But they need to be really aware of any changes in their body. I always feel your body's going to let you know what's going on. Hey, wait a minute now. Let me tell you about this. This is what the body is going to talk to you. And, I keep having these headaches now. You need to go see about it. So I would say if you have any symptoms, don't just blow it off. At least come and get it documented. Maybe like your way you walk, you could be off balance. You can have memory loss. It might come back to you, but, you can't maybe think of something in the moment. Maybe what you're normally doing, you're not doing it right. All of those can be signs that you might have an issue in your brain. So any of that, I would, I would come in and see about it.
So tell us about this monkeypox. First of all, what is monkeypox? And then how is that impacting veterans in the VA system?
So monkeypox is in the family of the smallpox, and is really impacting people with immune compromising conditions. So anybody who may be living with HIV, hematologic malignancy, like if you've got leukemia or something, organ transplant, stem cell transplant, chemotherapy, radiation, high doses, if you're on a high dose of cortisone. Some people who are asthmatic and have other breathing problems, or kidney problems, they may be on high doses of cortisone. You might have an autoimmune disease. You might have an immunodeficiency as a clinical compound, a part of that. So, pregnant women are pregnant or breastfeeding, and patients with disease that increase risk of strictures or fistulas, such as inflammatory bowel disease. So anything that is affecting your immune system, even though you're healthy, even healthy people can come down with it, but it's most likely will affect those that have these anti-immune disease situations.
Now, is this a sexually transmitted disease, I understand, or how is it transmitted?
Feel that it is, and some of the pox is showing up in areas that would be related to having sexual intimacy. So one thing I would encourage is that they do have protective sex, and because right now you don't know, it's showing up. Basically, the largest number is in San Francisco right now, but it is spreading. But a lot of people are not dying from it because they're having early intervention. But the treatment is more supportive. It has to be reported to the public health department. And then for you to get the treatment for the smallpox vaccination, it has to be approved by the FDA. So they want to have it where it's just going to be approved for emergency use right now, and they're working on getting that. They're asking for emergency usage.
So the smallpox, is that curable, or is it something you live with forever?
Well, the monkeypox is something that they say it kind of will hit you and then leave. So the intubation period is about 20 days, but it can be up to 121 days. So if you're starting to have any kind of, even a pimple, it could look like it's a pimple, but actually it could be monkeypox. So if you do, then you should really isolate yourself, make sure that it's reported, and then let your personal care doctor know so that they can get you diagnosed and treated.
But once you're treated, can it come back, or is it something that once it passes, you're pretty much okay?
Well, from the things that are out already, you will be okay, but we don't know what the long-term possibilities of this is.
And can you get reinfected?
Oh yeah, you can probably get reinfected because a lot of those vaccines, they only have a certain amount of years that is good for. So these are things that they need to discuss with the doctors and with specialists. And I'm sure if anyone comes down with monkeypox, that they will be seen by infection specialists.
So once you have monkeypox, or say you get the vaccine, which is you're saying it still has to be approved, how effective is a vaccine to keep you from getting monkeypox if you're exposed to it?
Well, this is what's happening now. A lot of people who have immune deficiency problems and stuff, they are encouraging them to get vaccinated to prevent them having it.
But it's fairly effective, the vaccines that are out?
Yes, it's very effective.
Okay. And then what's the process like if you have monkeypox and it gets, say you have a bad case of it, what can that person expect, and how serious can that be?
They say it's very, very painful. So far, there's on record that I'm aware of, only one person has died from that, but that is very, very painful, and that it will run its course, but it may also leave scarring.
So is it kind of like a rash, or?
No, it is raised like pimples, like you got a pimple, is like a super pimple. And it will show up around the contact areas, like if anyone's participating in oral sex or anal sex, it will show up in those areas.
So it almost sounds like measles or something like that, is what it sounds like.
Yeah, but it looks a lot worse.
Wow.
It's really bad.
Wow. So what are some of the things that we could be doing every day to improve our immune systems to help us fight some of these a lot of these diseases that seem like they're popping up all the time now? So we're getting hopefully got rid of COVID, or it seemed like we're kind of controlled COVID. It's still out there, but we're dealing with it now. Now we got monkeypox.
Yeah. So what happened with COVID? The more people who got vaccinated against it, it has helped to decrease the amount of people who are getting it, even though many people have been vaccinated are getting COVID, but the outcome is much better than in the beginning. And so the same with monkeypox, you have to, make sure your hygiene is really good, that you're washing your hands, be mindful of any exchange of bodily fluid, kind of same things we used to discuss when AIDS, HIV started. You want to be mindful of changing any bodily fluid. Some people are stating that they're going to be wearing more long sleeve tops so that they have less body exposed to the infection. So every day we'll be hearing more and more. So the public needs to just read up on it and stay aware. Read the site of the CDC so that you'll become aware, and the VA will put out information also for our veterans.
So bodily fluids is one thing we have to watch out for. So is monkeypox something that you can catch other than through sexually transmitted means or sexual contact? Can you get it from touching someone, or?
They're showing that you possibly can, like say you have an open wound or something and you're around somebody, but it's not probably that easy to catch because there'll be more of us with it. So that's always a good sign when you can point to what is the probability and the variability of these viruses. This is a virus. Your immune system, and the same thing we talked about with COVID, make sure you're eating right, that you are, just taking whatever you need to build up your immune system. Good food, make sure you're maintaining good health, blueberries, they got a number of things out that will contribute to improving your immune system.
So antioxidants and things along those lines, making sure you're eating a lot of vegetables, green leafy vegetables.
Green leafy vegetables, fruit. Right now, we have a lot of seasonal fruit that will help us to improve our immune system.
So,
and go ahead.
No, yeah, my question was going in that topic is a lot of people are using a lot of like these holistic natural remedies and things along those lines. Where do you fall on natural remedies versus using medicine, like prescription medication particularly?
My personal take on this, I believe in holistic medicine as well as traditional medicine. So I would say if you want to try a holistic route, fine. But if you're not getting better, then you need to go traditionally and meet with a doctor and then work with your doctor. There are doctors out there that believe in holistic medicine too, but there are some disease process that if you try to go the holistic way, then it will take a long time and you might end up being sicker or injured more than how you started out. So those are something that the public needs to talk to their doctors about. Don't, I know there's a lot of stuff on Facebook and Twitter and whatever else they go to. A lot of that has not been supported. But there are a lot of reliable articles relating to holistic treatments of, medical problems.
So my last question is goes back to the vaccine for COVID. So, are there going to be more boosters coming out? Is there going to be a situation where every year we're going to have to get, like we say, we get a flu shot every year? You have to get a booster shot for COVID. Is that what you see happening with COVID?
I'm not a scientist. As right now, we're encouraging everybody to get the booster. Please be mindful that as we're going into September and October, make sure you get your flu vaccine and also stay on top of your booster. If you've had one booster in certain population, they're encouraging you to get a second booster shot. So I myself will be getting mine in around mid-September.
Okay, so maybe every year, maybe think about getting a booster?
I will follow the science on these viruses and monitor my health. And should my health, start taking a turn, like if I become diabetic or have heart disease, any of these things, then definitely I will, seek to get a booster according to my health status.
Okay. But the key thing is making sure you're talking to your doctor to know if it's a good idea to get a booster, making sure that you're taking the right types of medication. If you're going to go the holistic route or go the route of being healthy or all natural, make sure that you're doing the right things and not taking stuff that's not really helping you and maybe prolonging your ailment.
Yes, and I'd like to also encourage our listening audience, men and females. Females don't have prostates, but those we love do. And, brothers, fathers, significant others, to encourage them to get their prostate checked. If they're in that age group, please get it checked.
So are we seeing, I don't know if you have this information yet, but are we seeing, are we ready for the next flu season? Are we seeing anything on the horizon, like any spikes in COVID cases? And now we're moving into fall?
Actually, our census with COVID cases in the area that I'm in, the Chicago area, is down some, but it could spike. We're getting ready to go into another holiday period on the 5th of September. So anytime that we're around a group of people. I'm seeing the public is getting a little lax about wearing masks, and they feel comfortable, but people also have more knowledge about how COVID is spread. But I would encourage you, if you're in any large group, to have a mask on. My husband and I still mask when we go to grocery store. If we're at a restaurant, we wear our masks. Inside, we have to take it off to eat, but we try to make sure our table is not in a crowded area. We tend to go later in the day or earlier in the evening for dinner where there may not be as many people. So you have to kind of think strategically on how you're going to protect your health.
Ms. Adelena Marshall, I appreciate your time. Thanks for all the information you've given us.
Thank you. Thank you for having us.
My pleasure.